When a powerful new medication takes away your hunger, it can feel like a miracle for weight loss, but it can also quietly put your body at risk if you start eating far too little without realizing it. A 66-year-old man recently shared that he began Mounjaro, tirzepatide, a month ago to manage type 2 diabetes and hopefully lose about 40 pounds. He carefully tracks his meals in an online food log and has noticed a big drop in appetite. His main concern: what is the lowest number of calories he can safely eat each day without missing out on essential nutrients? Dr. Roach's answer is clear. Once daily intake drops below roughly 800 to 1,200 calories, the chances of not getting enough protein, vitamins, and minerals rise significantly. At that point, the body may not receive sufficient building blocks for muscle maintenance or enough micronutrients to support normal functions. People consistently eating in that very low range are usually advised to use supplements, with particular attention to calcium, iron, and vitamin D, which are commonly underconsumed when food intake is restricted. But here's where it gets controversial. Extremely low-calorie diets are often praised for rapid weight loss, yet they can be nutritionally unsafe if not carefully planned. When calories are that limited, the small amount of food you do eat needs to be packed with nutrients. That means prioritizing foods that are rich in vitamins, minerals, and fiber but relatively low in calories, such as most vegetables and fruits. Think colorful salads, steamed or roasted vegetables, legumes, and whole fruits instead of processed snacks. The goal is to get maximum nutrition per bite, not just focus on the scale. To help with this, many online nutrition and meal tracking programs offer detailed breakdowns of both macronutrients, like protein, carbohydrates, and fat, and key micronutrients, including fiber and certain vitamins and minerals. These tools can guide people using appetite-suppressing medications like tirzepatide, Mounjaro, toward choices that keep them healthier while eating less overall. A similar approach is used after bariatric weight loss surgery, where there are established supplement plans and specific dietary recommendations designed to prevent nutritional deficiencies. Interestingly, Dr. Roach notes that, in his own practice, most patients taking GLP-1 medications such as Wegovy and Zepbound do not end up cutting their intake to such extreme levels. He suspects this may partly be because he tends to recommend more modest dosing, which helps reduce appetite without pushing people into dangerously low-calorie ranges. The second question he received shifts from weight loss to infection risk. Should someone who never had chicken pox as a child, but did receive the chicken pox vaccine later in life, still get the shingles vaccine? A 60-year-old reader explained that both she and her sister somehow avoided chicken pox during childhood. Her sister eventually caught chicken pox as an adult, after being exposed to her daughter, and had a very rough experience. Concerned, the reader followed her doctor's advice and got 2 doses of the chicken pox vaccine at age 40, at her son's urging. Now, 20 years later, she wonders, because she never had natural chicken pox, only the vaccine, is she actually at risk for shingles, or is she essentially protected? And this is the part most people miss. Yes, she can still get shingles, even though she only had the chicken pox vaccine and never had the wild virus infection. The currently licensed chicken pox vaccine uses a live but weakened form of the virus. This vaccine strain is less likely to later cause shingles than the full-strength wild virus that her sister caught, but it can still remain dormant in the body and reactivate later as shingles. For that reason, Dr. Roach recommends 2 doses of the recombinant shingles vaccine, Shingrix. Unlike the chicken pox vaccine, Shingrix is not made from a live virus. Instead, it is a subunit vaccine, meaning it uses a specific viral protein, produced using bacteria, to train the immune system to recognize and quickly fight off the real virus if it tries to reactivate. For adults, this approach offers strong protection without exposing them to a live viral strain. Shingles itself does not come from a brand new infection in most cases. Rather, it occurs when a latent varicella zoster virus, the virus that causes chicken pox, wakes up and escapes immune control. It typically flares along the pathway of a single nerve, in a region of skin known as a dermatome. The term shingles comes from a Latin word meaning belt, because an outbreak on the abdomen often appears like a belt-shaped band wrapping around one side of the body. On other body areas, the belt-like appearance can be less obvious, but the pattern still usually follows a single nerve distribution. The Shingrix vaccine has been shown to be more than 90% effective at preventing shingles, and it appears to be even more effective at reducing the risk of long-lasting nerve pain that can follow an outbreak, known as postherpetic neuralgia. That chronic pain can severely affect quality of life, so preventing it is a major reason vaccination is encouraged. The most common downsides are relatively mild. Many people experience a sore arm and may feel somewhat fatigued or off for a day or two after getting the shot. Shingrix is approved for adults over age 50, as well as for younger adults who have weakened immune systems due to certain illnesses or medications. This makes it an important preventive tool not only for otherwise healthy older adults, but also for people whose immune defenses are compromised. Here's a twist that could spark debate. Recent research suggests the shingles vaccine may also help reduce the risk of dementia, probably because it prevents some of the blood vessel damage that can occur during shingles infections. This idea, that a vaccine aimed at one condition could meaningfully affect the odds of developing another serious disease, raises fascinating questions about how infections, inflammation, and brain health are connected. So, what do you think? Should very low-calorie diets on powerful weight loss medications be more strictly supervised, even if patients love the rapid results? And when it comes to vaccines like Shingrix, do you feel more motivated to get vaccinated if there might be additional benefits, like a lower risk of dementia, or does that kind of claim make you more skeptical? Share whether you agree or disagree with these recommendations and why. Your perspective could help others think through their own decisions.